One of the things that we are very proud of and we think is quite unique to Staffordshire and Stoke is how we've worked with the independent sector and our 2 NHS providers.
We now have a network of providers, so the care home sector's worked really well with us and together to actually put in place the very specialist type of care that we need. Whilst we're still growing that market and there's still some work to do, I think we do now have a network of homes that can provide the level of accommodation and care that our patients need.
So very early on in the TCP, what we realised is that we really couldn't do what we needed to do without the support and cooperation of our 2 local authorities. And in order to make sure that happened, we brought in 2 deputy senior responsible officers, 1 from each of the local authorities. And thankfully, with funding from NHS England, we were able to appoint one of those as the Deputy SRO to help me and support me and the team to deliver the programme.
When we started this work in transforming care, we didn't have competent providers in the area, or very few competent providers in the area, who could work with people with complex needs who needed discharge. So we were being pushed to discharge people in hospital. We had nowhere for them to go locally.
From my perspective, as a lay member for public and patient involvement, the TCP have identified and engaged with providers. They've used innovative ways to provide services for very complex and difficult cases.
We've actually spent a lot of time together as a team. We talk through each patient on a monthly basis at the provider forum. We make sure that we've supported providers with additional training that they were struggling with. So we actually commissioned a barrister to come in and actually talk to all of our independent sector providers, our NHS providers, and our own teams, so that we were all absolutely clear what it took to legally discharge some of the individuals that we did.
I think when I was a nurse and people were moving out of hospital then, I thought that'll never work, but that was 30 odd years ago. And I think that times have changed now. I think what the TCP team did that was different is the Providers Forum actually started to discuss openly and transparently a group of individuals that they had that they couldn't find solutions for immediately. And I think initially most people thought that it's a competitive market, but actually very quickly became apparent that it wasn't, that the skill set around the room was very different, and that the market was there for every provider.
Initially, the providers were very sceptical, and they were looking at each other in the very first meeting. Individual commercial organisations don't usually work together in this way, but when you look a year down the line, it's not unusual for them to share good practice. They talk to each other about things that work well, things that don't work so well. So I think the Provider Forum is something that we have been absolutely delighted on how it's grown.
For us, when it works well, there's a lot of energy, there's a lot of commitment, there's a lot of discussion with and involvement of the multidisciplinary teams, and a real good solid support structure. So as a provider, you don't feel as if you are on your own.
The main challenge was this cultural change from running the secure services to being a community provider. And we wouldn't be able to achieve this without support from the CCG and from the Transforming Care team. And they help us a lot during this journey.
We also brought in some trauma training because we recognised that some of these individuals have got trauma backgrounds, and it was an area the providers felt that they needed. We also brought in other training around mental capacity and safeguarding. So we've spent a lot of time trying to equip the team in the provider network.
In terms of staff training, clearly induction, mandatory training is very important, but when you start to work with people with more complex needs, it's really, really important that people understand those needs. They understand what autism is and how that actually impacts on that particular individual that they're supporting. And we've actually accessed some of the training that's been delivered through the Transforming Care programme, which has been really, really positive and helped us embed that. And now we're looking at our managers going on to do qualifications in PBS themselves again, so we can ensure the quality in-house.
Let's not kid ourselves, it has not been an easy move forward. The challenges are still there, we still have to look forward, there's still our financial difficulties that we face, but we've come from a difficult position to a very strong position. And can I emphasise that it's all about engagement and the approach of integration with these difficult individuals.